times providers are more comfortable treating people after they're not pregnant anymore. So I'm always like, oh, I wish that you would have come while you were pregnant. But yeah, when they come after pregnancy, a lot of times is when they think that it's like the baby blues, which is actually prevalent in 70% of moms.
Wow.
Yeah, it's pretty high. But if they get the feeling that it's more than that, then they come to see me. And just a fun fact, even though it's not really fun, but an interesting fact is that dads can also get postpartum depression too. So I'm just letting people know because I think a lot of people don't know that. So a lot of anxiety, a lot of depression, tearfulness. You know, if you're up taking care of a baby all night and your hormones are changing, you're gonna have some tearfulness. But if it's like you're constantly crying and things like that, so that's when people come and find me. But I also wish they would have found me sooner while they were pregnant.
Oh, we have a question coming in. What is the difference in your approach when a mom comes to you during her pregnancy versus postpartum?
Oh, that's a good question. So the first thing that popped into my head is, because mostly I do the medication management. We have a therapist too, but the majority of what I do is medication. So the first thing that popped into my head is, if she's postpartum, is she breastfeeding? And then if so, like what percentage of the medication that I'm going to prescribe is going to be present in the breast milk? I don't have to figure that out if she's pregnant, but I do have to figure out if it crosses the placenta. And so just immediately math came into my head. So I just think about the medications and how they're going to get into the baby, whether it's through the mother's bloodstream or whether it's through breastfeeding. So that was the first thing, because for example, when I treat ADHD, the stimulant medication methylphenidate actually is transferred in a lower percentage into breast milk than something like Adderall, which is a higher percentage. So if she's not breastfeeding, then I don't have to factor that in. But there's more, I would say there's more similarities, like getting support. You need support while you're pregnant and you need support after you're pregnant, like from a family perspective. So I would say things are more the same, but the big one that stood out is I have to calculate the medication.
I have to say, you know, those thoughts also cross our mind in our field. Even though they're very different fields, we're both trying to help people feel better about themselves during these periods of change. Certainly I get questions all the time, can I do my Botox, can I do my fillers during pregnancy? There's no clinical studies that suggest that it's safe, so we discourage those kinds of treatments. But you should know, even in our field, when people come in and they're pregnant, we're thinking about what skincare products can we use, what treatments are acceptable that
not
are
retinol.
That are not going to cross the placental barrier. We also are asking people about, are they nursing or they're not nursing, so that we can make educated judgments about what's safe and what's not safe for them to do. But either way, it's both about helping people feel better.
Right.
And I have a question for you, Dr. Lickstein. What are some of the popular, I guess, procedures or services that moms look for after giving birth?
Oh, that's such a broad question, and it's so personalized and individual. The first thing is, you know, people think about plastic surgery in terms of what we do to bodies and what we do to faces. The truth is, we're affecting the mind as much as you are. I mean, it's about how somebody feels about themselves. So the opening question always becomes, what's troubling you? What makes you self-conscious? What's concerning you? Now, there are some themes that are exceedingly common. Obviously, women's bodies undergo profound changes during pregnancy. So from a body perspective, it may be a tummy tuck that somebody wants. They have extra skin.
Extra skin.
Destabilization of their muscles or separation of their muscles. It may be changes related to nursing. The medical term is involution, but their breasts may deflate and descend. But I'll be honest, we see moms that are perfectly happy and proud with their mom bods, and that's amazing and that's wonderful, but they may say, my daughter's now a teenager and the things that she tells me makes me frown and I really need to get rid of my 11s. And so I have to say, teenage daughters, I think, fuel the Botox business, but it's individualized, it's personalized, it's about helping somebody feel better about themselves. It's not really about us having this ideal version of what a mom should look like. Because a lot of moms, understandably, appropriately, and I admire and respect that they wear some of those changes with pride.
Well, that brings up a good point, and it's the individual, like what it is that they're looking for. And when we spoke earlier, you talked about something that I do all the time at my practice, which is managing expectations. So somebody comes in and they say, when I leave, I want to look identical to Kim Kardashian, and you have to manage expectations. So tell me about how you tell people that's.
I so wish it were that easy that people would say those things to me, because then I could easily step aside and say, I'm sorry, I don't think I can meet your expectations. But it is a tricky thing to do in both of our fields, to sort of get a sense for what somebody wants to achieve. And there is subtlety to listen to the way somebody talks about themselves, because sometimes they may be talking about their body, but when you really listen, there are other things about themselves that they don't like. And to be candid, oftentimes they're far more appropriate to speak with you than they are to speak with me. But other times it's just a matter of, building a relationship, much like when you put somebody on medications or you start therapy with them in your practice. It's a journey to make a meaningful transformation. So is it in our case. And so when a patient comes in here, mom or not mom, we're starting that journey, we're starting that conversation, we're starting to build that relationship, because we know if we want to develop meaningful change for a client, that's going to be a longer process, a discussion of what they're hoping to achieve, what's possible, and then the different interventions that we can do along that way to help realize their best visions of themselves and healthiest visions.
That's really important for managing anxiety, because let's say the person has just maybe panic attacks or something, and then you have this very complete conversation as you just described. That's going to help them not to be nervous. So let's say they're just one of the 20% of people and they just happen to have an anxiety procedure that they're about to get. Whenever you're speaking with them and telling them what to expect, how long, being very thorough, that's going to help alleviate any sense of anxiety and be protective against them coming in not knowing what to expect and then getting really nervous. So I think that's really great.
And not talking about that 20%, I mean, there are plenty of people who come in here who say, oh, mom, I've got 3 kids at home. You're electively putting me under an anesthetic, and that's
gonna be nervous anyway.
That's providing me with a lot of anxiety. I'd be curious to hear what your advice would be for how we should help people sort of make it through that period of anxiousness around the time of surgery.
I have an idea, a support person. So I'm assuming that for a lot of these, you have to have somebody driving them home.
Absolutely.
So maybe see who that person is. Are they somebody who's going to stigmatize them and make fun of them for whatever they're doing? Or is it somebody that's just going to drop them off and then not check in on them? So I think it's important to be protective. A protective factor against any sort of anxiety is to make sure their support person is actually supportive and not like a toxic person.
Love that. We see people all the time, and I see spouses that are overwhelmed by this. Like, they're scared about the changes their significant other are going to go through.
Right.
They oftentimes want to be supportive, but have no idea what that really means, like what the person needs. We have conversations preparing our patients to sort of tell them to come up with a plan. Like, your loved ones around you, your friends, they want the best for you. They want great outcomes, but they don't know what to do. So assign them things to do. My sister will help me with meals. My brother's going to or my spouse is going to take me to and from surgery and to my appointments.
Right.
My other friend can help me get medications.
Divide. Everybody gets a task.
But you are right in the sense that developing that atmosphere of support is critically important.
Right.
For everything that we do.
So Dr. Lickstein, you made a point earlier that was really, really interesting that we'd like to just hear a little bit more on. You were saying when you're meeting with a patient, you listen to not just what they're saying, but how they speak about themselves. And sometimes it's apparent to you that they might need to start with Dr. Waggel before they actually start with you. How do you approach such a sensitive topic with them?
You took the primary word with sensitivity.
Yeah.
I mean, I think, one of my mentors used to say, there's nothing that substitutes for being gently honest. Our patients are coming to us for our opinion. They're coming to us for our thoughts. We have decades of experience treating people, and we are genuinely invested in their best interest in getting them help. So when we get those signals that, you know, sometimes I get the feeling that it's not really about your breast or your tummy or your ears or your fat. You just have some a patient may have some self-image issues, or candidly, some people just don't like themselves at that point in their life. And we need to open that up as a conversation, a gentle conversation, a kind one. We don't try to embarrass or make people uncomfortable, but when the message comes from a place that we just want the best for you and we want to offer help, it often can be received by the person out there. But it's tricky.
Can I jump in?
Yeah,
because
please.
one of the things that I do is I do grand rounds for different departments that need to figure out how to refer their patients to psychiatry, and it's you've got to be very sensitive, but just I have one word that I just teach them to say, and that's the word deserve. So if you are a different specialist and you have a patient and you want them to go to psych, you shouldn't be like, you need mental help. Like, don't say that, because that's really offensive. You need to say, you deserve the best treatment that you can get for XYZ that you're telling me. So whenever I'm telling other specialties how to refer to psych, just use the word deserve. Like, when you're talking to the patient, you deserve this other specialist that helps in this particular area. So that's just like a quick fact that I give to other specialists.
I love that, Dr. Waggel. I'm stealing it from you, but I'll give you credit. I'll credit you for it. It's funny that you say that, though, because I've been involved in resident education and medical school education at different parts of my career, and sometimes I've had conversations with residents and fellows that it's very easy to say yes to a patient and offer them something. It takes a lot more experience to say no in a way that they understand.
So true. Marion back there helps me say no to people all the time that ask me to do things that I just don't specialize in and I can't do. That is great. It's learning how to say no. That's where experience. You need the experience.
So I have a follow-up question for you, Dr. Waggel.
Okay.
Based off of what you were saying earlier, how do you empower a mom patient who is looking to choose herself and that she wants to get plastic surgery, but she can't get past public and culture saying a mother shouldn't focus on her body now or how she looks because you're a mom now?
Oh, so we have the conflicting mentalities here. So people will explicitly say, you just need to be comfortable with your new mom body and embrace it. But then our society that we live in, like, has the undertones of always throwing these images in your face of women who don't look like they've ever had or even seen a baby before because they clearly have never had any stress at all. So it's this conflicting message constantly, and it's like, be happy with what you have, but also look perfect simultaneously. And it's just like not realistic for anybody. So the first thing, getting back to the support person, if you know that your support person is gonna poo-poo your idea and be like, no, don't do it, find something else that maybe it's none of their business. You know, my kids, we have these books. It's like, My Body is My Business, right? And so you could maybe read that book. It would be good for grown-ups too. If they feel like the person that they're going to tell is not going to be supportive, well, maybe that person doesn't deserve to know what they're doing on Tuesday morning for, you know, just don't tell them. But then also think about who will be supportive, who will be kind, and maybe spend more time with those people. So if she's feeling bad, we got to do the analogy about you're on the plane and you need your oxygen, and then I'll write the prescription because people feel less guilty to do things if the doctor told them to do it, and then to not tell people that they think are going to be rude, and maybe talk to those people less, and then if they want to talk about the procedure, make sure that they choose people that are supportive.
Yeah, and I do think that conversation is easier now than it was perhaps 10 years ago because of things like this and social media. I think there's been the general democratization of plastic surgery. It certainly is not for the elite anymore. Everybody wants to do plastic surgery or have a procedure. Everybody wants to feel better about themselves. But I also think social media has helped educate and inform. I think 10 years ago, I had a lot more patients come in and say, my husband's not really supportive of this because he says I should just go to the gym or I should lose a few pounds.
Which isn't always going to work, let me tell you.
Which often isn't going to work.
It doesn't get rid of your extra
because,
skin.
you know, there are things that people can achieve through themselves, but as you mentioned, you can't exercise off your extra skin.
No.
If your muscles are separated from having a few pregnancies, you
Right.
can improve muscle tone, you can't change the way the muscles relate to each other. But I do think there's far more awareness now than there used to be. That's not to suggest that the problem doesn't persist, but thankfully it's maybe a little less common now than it was years ago.
And then I have just one more question before we go into our conclusion. What are some resources that you both recommend to patients who come to you presenting with what you see as they're falling victim to the stigmatization that society is putting on moms?
Oh, Dr. Lickstein, do you want to go first?
You know, resources, I think we're the resource. You know, come seek out the professionals to have the conversation.
Us.
But it's so easy these days. I mean, the internet has made the world a small place. www means something for a reason. It's worldwide. They can get all sorts of information. So when patients do have those doubts, when patients do have those questions, that's the place to start. But then we always encourage people, you know, find somebody local to have that conversation with one-on-one. We're here to sort of give the message that that these sort of services, be it mental health, be it physical health, be it plastic surgery, are beyond the era where they should be stigmatized, because the truth is there's data now that we can discuss with our patients. We know that patients that get their mental health issues addressed do better in their life. They interact better, they have better social interactions. We know people who have more self-confidence have the same benefits. So the data is there, the resources are there. I just encourage people to sort of be open and honest with themselves and be willing to have that conversation.
And I like that you said that we're the resources, because a lot of times people mistakenly send people to the wrong resource, and especially for prescribing medication to people who are pregnant. There are so many providers out there that aren't educated in it or not comfortable, and so if you are giving resources and the patient goes to a person, that can really create a whole distrust for all medical professionals in general. So it's honestly better to not refer anywhere than to refer to somebody who doesn't know what they're doing and is going to create distrust in the patient. So I find that Postpartum Support International does do a pretty good job of screening who they refer, instead of just putting any person, like they're certified in perinatal mental health.
So where do clients or people get that information? Postpartum Support, is that a
Postpartum
website, an
Support
organization?
International. It's an international organization, and it's a website. So, and then in this area, there's Postpartum Support Virginia, actually. And so they list people who actually know what they're talking about. Because if your patient goes to somebody that is just very hesitant, then the patient's gonna leave with a bad taste in their mouth and be like, oh, I don't want to see anybody. That was not a good time. So we refer to professionals like us.
Our website too, the resource list on our website.
Well, we on Improve Life, we have a resource list too, which is getting long, but we actually go and meet the people that we refer to, because it's not good to refer to somebody that you don't know or trust.
And Dr. Waggel's obviously making a very important point that you want to find the people with the right certification, with the right experience. So board certification matters. Certainly in our field, lots of people are wanting to do aesthetic services that maybe aren't in the core training of having done plastic surgery or been board certified. So nothing substitutes for doing your research.
Right. You want to read about people before you go, and well, that's what the internet will help. You can find anybody. You could find all sorts of background information about people.
Well, I want to thank our audience for joining us today here
Thank
on
you,
the Instagram
audience.
line from Elle Aesthetic Arts and Plastic Surgery. It's been my pleasure to welcome Dr. Stephanie Waggel and her team, and Miriam, her assistant, here to Elle
She's
Aesthetic
off
Arts
camera. Hi, Miriam.
Hi, guys.
from Improve Life. I hope this has been an exciting conversation for everybody. Know that our next Instagram Live, at least here at Elle Aesthetic Arts, is on International Women's Day. Zainab Musafiar, our superstar esthetician and director of medical aesthetics, will be open for questions. When's your guys' next event?
I don't know.
We'll probably do
To
something
determine.
tomorrow.
Tomorrow.
We do little videos pretty much every day.
So I hope you'll tune in. We hope you'll follow both of our pages. Thank you for your time. Thanks for joining us.
Yeah.
Thank you.
Yeah, thank you so much. It was really fun. Bye, everybody.
Bye-bye.